Could the 2021 budget bring a much larger allocation to the health sector? The midterm review brought an increase in government's 2020 allocation for the health sector. Vidia Ramphal looks back at how the additional funds were distributed to the health sector.
The midterm review of June increased government's allocation to the health sector for 2020 and also revealed the outlines of government's plans for the sector. In Monday's budget statement, we could see this trend continue. Here are a few of the highlights of the midterm review. First, Finance Minister Com Imbert laid out a stark reminder of the importance of the health sector.
During this pandemic, whatever the health sector needs, the health sector will receive.
The health sector was allocated over $6 billion for 2020, the third biggest allocation behind education and training and national security. In June, Minister Imbert announced that an additional $224.5 million would be redirected to the health sector.
Facilitate payment to 11 new intensive care nurses from Cuba, 20 doctors attached to the Ministry of Health's COVID-19 hotline, and other staff in response to the COVID-19 pandemic.
The lion's share of the increase, that's over $184 million, was funneled towards the 4 regional health authorities.
The funds are to meet the cost for consumables, infrastructure and equipment, and the procurement of additional human resource services.
Of the remaining sum, government also reallocated over $36.8 million for the completion of hospitals, including the Arima Hospital.
Sum of $36 million, $878,335 is required to facilitate the payment of interest on a number of loan facilities in the health sector for pharmaceuticals and other medical supplies, and for the redevelopment of the central block at the Port of Spain General Hospital, and for the completion of the Arima Hospital.
Outside of this, $105 million was apportioned to the Tobago House of Assembly. Just under half of this was for the health sector in Tobago,
including training of healthcare workers, educating the public, establishment of primary healthcare facilities to meet the needs of persons in quarantine or self-isolation, and manage patients who test positive for the virus.
The midterm review increased the allocation to the health sector by almost 4% to just under $6.25 billion TT. When the midterm review was read in June, the number of COVID-19 cases was 117. With the reported number of cases now over 4,500, a health sector allocation of unprecedented size is certainly within the realm of possibility. Vidia Ramphal, TTT News.